Hello, my name is Dr. Stanley Lang, and welcome to this video, which is on the subject of chronic pain relief beyond CBD. So the reason I say beyond CBD is because since hemp oil or CBD oils have become available, this has become one of the most powerful tools that doctors and non-doctors have been pulling out to offer to patients for pain relief. Now, I see multiple patients every day that have chronic pain as part of their issue. Sometimes it's the main reason that I'm seeing them. I wanted to just go through a very quick list of things that I have found to be very helpful as part of the picture for chronic pain relief beyond CBD. Now, why do I say that? Two reasons. First of all, CBD doesn't work for everybody. Second of all, it works better if you're doing these other things. It's been my experience that if it's layered on top of these other strategies that I'm going to talk about, that CBD works better. And finally, at the end of this brief video, I'm going to touch on how you can personally use stem cell therapies in a new way that wasn't available just a couple of years ago. And I'm not talking about stem cell injections. I'm talking about something that is both legal in all the states and affordable. But on with the list of things. First of all, I recommend a whole person health or holistic approach to stress reduction. That means looking at physical, emotional, and spiritual issues that are going on in our lives that contribute to stress. And there are usually things in each one of these three areas that are contributing to stress that I'm going to touch on briefly that you can do something about. The first is eating in a way that decreases inflammation. That means eating low glycemic, which means eating foods that don't raise the blood sugar quickly, and avoiding bad fats. And by doing these things, you decrease the microinflammation in your body dramatically. Now, there's a lot of foods you can eat that improve that balance, but cutting out the high glycemic foods and the bad fats is the most critical part of that nutritional strategy. The next thing that you can do is build core muscle strength. Now, most people's core is extremely weak, and the core muscles that are most weak within the core for almost everybody are their gluteal muscles. If you build gluteal strength as you build your whole core, you will decrease your pain substantially because the glutes play a huge role in stabilizing your back, and most people's pain is at least in part related to their back and their neck. The third thing that you can do is in the area of the spiritual issues that I talked about briefly, which is thankfulness and forgiveness. This dramatically contributes to stress reduction. If you focus on thankfulness and forgiveness every day, you will decrease your stress and you will have less pain. The next thing that you can do is increase the anti-inflammatory nutrients that you are consuming. These are the essential fatty acids, which means the omega-3s and omega-6s. Now, a lot of people think omega-6s are pro-inflammatory, and that's based on faulty science because they used damaged omega-6 when they did that research. But most people are missing out really on the omega-3s, and so the essential fats, omega-3s, are critical to replace. And then there are a lot of different other nutrients that will also have an anti-inflammatory effect that I encourage my patients to consume, and especially working on the biome. So that includes probiotic foods that are still fermenting. The next thing is something called Christian Qigong. So Qigong has been around for thousands of years. Christian Qigong has been around for a lot shorter period of time. And I've discovered that this dramatically decreases pain in the patients who practice it. And I personally know that it's decreased my pain quite a bit. Now, the last thing I want to talk on briefly, just to mention, is the stem cell activation. I might call this the easy button. So there is a new technology that allows you to activate your stem cells. And when you do that, for most people, it decreases their pain quite a bit. And sometimes it decreases their pain very rapidly, sometimes slowly. But in the majority of my patients who have tried this, it has dramatically decreased their pain. And it's very affordable, and it's something that you can start right away. These other strategies are long-term strategies. They're the things you do for the long haul, and they will pay off. I guarantee that if you do the whole list of things, you will have a lot less pain than you're having. I don't care what kind of pain you have, it will be less if you do these things. But they take some time for it to start to work. This is something that starts to work very quickly in a lot of people. And so that's something that I encourage. And it's a simple strategy that anybody can grab onto. So I wish you well. I hope you have less pain as a result of following some of these strategies. God bless and have a great day.